Hello everyone, welcome to Pathomad. Today our topic is about seborrheic keratosis, which is the most common benign skin condition. The reasons being unknown, but few of the cases shown mutation in this gene called FGFR3, that is the fibroblast growth factor receptor 3 gene mutation. Few other cases also show increased expression of as- amyloid precursor protein precursor protein. The most common sites for this seborrheic keratosis is the head and neck and trunk. So the seborrheic keratosis never ever involves palms, soles, and mucosal surfaces. These are never involved. These three are never involved. Grossly, seborrheic keratosis gives a stuck-on appearance. So it shows as if some material has dropped and stuck to the surface of the skin. Grossly, few of them are dry, few of them give a glossy or the waxy appearance. And also the external surface is cerebriform, means like external surface of the brain, how it shows gyri sulci. In the same way, they show the grooves and ridges, elevations and depressions. So hence it looks like a cerebriform external surface. And these are blackish to brownish papules is a waxy cerebriform surface. Coming to the histopathology, seborrheic keratosis have many variants, but acanthotic variant is the most common. Acanthotic variant. Acanthosis means increased layers of the epidermis. Increased layers of the epidermis. That means that is thickened. It is thick epidermis. Comparatively to the normal skin, the epidermis is thickened. The width of the epidermis is increased, and the rete they come down into the dermis and give you a merged or interconnected appearance. The rete is the projection of this epidermis into the dermis. These are called rete they come down, they almost merge with one another. And also the epidermis shows you cysts, various number of cysts. All these are cysts. So here another slide. Here it shows you multiple cysts. These are actually pseudocyst. Pseudocyst. Why pseudocyst? Because it is not a true cyst. When you cut through the skin, the cysts open up onto the surface of the skin. They have connections towards the surface of the skin. Hence it is pseudocyst. Also they are called horn cyst, because they are filled up with this keratin material. Various layers of keratin are present, and these keratin layers, they are anucleated. They do not retain the nuclei. This is the dead keratin, a dead keratin. The same keratin that is found above the stratum corneum, this same material is present within the cyst. It is a dead keratin, also called orthokeratin. Orthokeratin. Because this pseudocysts, they are filled up with this dead keratin, they are called horn pseudocyst. Like a rhino's, their horns, they are made up of keratin, dead keratin. Because of that reason, it is called a horn cyst. Pseudo horn cyst. So keratin-filled cyst, these are the characteristic feature of a seborrheic keratosis. Also the epidermis, it shows the epidermis is never ending, thickened epidermis. There's another entity called laser trellat sign. Laser trellat sign means this sudden onset of multiple seborrheic keratosis. See over the trunk, there are multiple stuck-on papules here, brown papules. And this onset, they appear suddenly. Sudden appearance of multiple seborrheic keratosis should give you a suspicion of underlying gastrointestinal malignancy, or GIT adenocarcinoma. It should give you a suspicion. This is called a laser trellat sign. Laser trellat sign means sudden appearance of multiple seborrheic keratosis, which is associated with underlying GIT malignancy. Thank you, everyone.